What do you think are some of the advantages of this process versus a, quote, traditional second opinion, unquote?
So I think that, one clear advantage for the patient is really in terms of convenience. If you're thinking about obtaining a traditional second opinion and purchasing a plane ticket to go wherever it is that you'd like to go, I think that the beauty of this process many times is that the intellectual expertise can be brought to the patient through this process. But I think that in addition, I do provide some traditional second opinions through my own clinical practice. And when I think about what this process is like in comparison to my day-to-day experience, I think that, number one, the data aggregation is key. Many times I'll have most of the data when I'm seeing somebody for a traditional second opinion, but I often find that there's key elements that I wish I had and that I have later and try to then reintegrate into my assessment. And it's nice through this process to know that that is pretty much comprehensive and complete through what we do at Best Doctors. I think that's very helpful. I think another area that's very helpful is that in the traditional second opinion, again, I think this is all within the context of sort of experience as part of daily practice, which is sometimes pretty busy, I think, as anyone who's in practice knows very well. And I think that by taking this process at Best Doctors kind of offline from that, doing this at a time that there's sort of careful reflective review and extra time to formulate these opinions, I think that the end product is fairly comprehensive. And I think that the final piece I would add is that by having the clinical summary in front of you, that creates a more consolidated way to look at the past history as opposed to, again, trying to bring in these disparate data elements from in a traditional way in usual practice.